Hey everyone, welcome back to our second part of our endocrine nutritional metabolic disease topic on ICD-10 CM coding with C&M Glass. My name is Melanie Grant, and we're picking up right where we left off on our last video, where we already talked about endocrine diagnoses with a brief look at anatomy, thyroidisms, and some of our hormone insufficiencies. So now we're going to look specifically at diabetes mellitus, and we'll close it off with a brief notation about vitamin deficiencies and, where to find long-term and current drug use. So for this video, just a reminder, if you hadn't watched the first video or if it's been a minute, we are using the ICD-10 CM 2019 Expert Edition published by AAPC, and I will be referencing the textbook I have, which is the Let's Code It 2019 edition from McGraw-Hill. If you're following along, you can use any coding book that you'd like, and hopefully you'll have all the resources in front of you so you can do some of the codes with us. So, diabetes mellitus, okay? I keep saying diabetes mellitus instead of just diabetes because there are in fact two different types of diabetes that a person can have. For diabetes mellitus, this is the most common one that a large amount of Americans and adults have, as well as some young adults, some teenagers, and some kids. Most people are familiar with type 1 or type 2, which was also previously known as juvenile and adult. I probably misspelled that. Just ignore my spelling there. I'm checking. Did I spell that right? Juvenile was commonly referred to as type 1, whereas adult was referred to as type 2. A couple of years ago, they did away with this definition. Why? Well, they found from recent studies over the years that a lot of people would have type 2 when they were kids or type 1 later on as an adult, and so calling it juvenile and adult just wasn't appropriate in terms of identifying diabetes. So when we look at diabetes mellitus as a diagnosis, as a condition, the age isn't important, but rather what type is defined. And as a default, if it's not defined, it's automatically defined as type 2. Now, I have OR here because there's other types of diabetes mellitus that can affect a patient. You have in your textbook, you have several definitions for these, and I won't read through them. I'll let you do that. But it's on page 204 where we indicate the definitions and types for type 1, type 2, secondary, which is a condition that's caused by another condition, meaning that diabetes wasn't something they would have had if they didn't have this other condition, aka there's two codes at least, and gestational diabetes, which we've already learned about, that can happen to a mom during pregnancy. So when we look at these different types of diabetes, the first thing to identify is what type it is, and that's going to direct you to the different codes in your ICD-10 CM book. Now currently I can tell you there's two codes that stick out to me as a coder, and one of them is E11.9, which is the very basic diabetes code, type 2 unspecified or uncomplicated, without complications. This one's very common because we see it a lot of times with diabetic patients who are under control, or we see it commonly listed for patients that are type 2 diabetes that maybe have complications that the provider just didn't pick up. So this is one of the most common codes in the ICD-10 CM codebook that I've ever seen, and I've worked with a lot of coding, but it's not always the correct code. So let's take a look at some of the different types of complications and manifestations we can see in diabetes. We have here listed on page 205, the diabetic manifestations can include ophthalmic, meaning conditions with the eyes, such as retinopathy, which is a very common one that I've seen, neurological conditions or manifestations where they start to have symptoms of the nerves. So one of the cool things about diabetes, not so much cool to experience, but cool to learn about, is that when you have so much blood sugar in your blood, it actually starts to seep out. And what's right next to your blood vessels, your arteries and your veins, but your nervous system, your nerves. And so when that happens, the blood sugar can affect the nerves and cause it to have either pain, burning sensation, or shooting up from the feet. Commonly, that's going to be commonly where patients start to feel it. And so that is a complication of uncontrolled diabetes that is not doing well. Renal manifestations, this is where they have conditions affecting their kidneys, and that can go into a lot of different areas. And you have circulatory manifestations. So remember, too much of a good thing is never a good thing. And as we look at diabetes, that's exactly what we're talking about. Now, beyond that, you also have a couple other things that you should keep in mind, which is such as hypoglycemia, which can be a condition of diabetes as well. And so if the patient is documented in the note during the day as type 2 diabetes without complications, but with elevated blood sugar, then that is going to be a complication of the diabetes, and you should not be picking up E11.9. You should, in fact, be picking up E11.65, I believe. Let's see if I'm right. We'll look at that real quick. I'm in my ICD-10-CM book, and I turned over to page 524, E11.65, diabetes mellitus type 2 with hyperglycemia. Hey, I had that one right. So another one that you'll be familiar with, high blood sugar translates to hyper, meaning high, glycemia, and that's going to be E11.65. So you can tell these are common codes because I have them memorized. One thing to keep in mind, though, is you never need to memorize your codes. In fact, even if you feel that you have memorized a code and you're very confident, just like I said, I think it's E11.65, verify in your code book. Always look up your codes before you apply them, because everybody can remember them wrong. It's not our job to remember all the codes in our coding book. It's our job to remember how to find the codes, how to use the coding book in order to find the most appropriate, most specific code and code to the highest specificity. We can't do that if we're constantly memorizing codes, because our codes change. Our patients change, our conditions change, and things that we may not have looked at, that we may not have memorized, may be sitting there staring us right at the face if we just open the book and look at it. So it's very important that we don't try to memorize codes. On the same end, if you're using Google, Google is definitely your friend, but never marry her. Never marry a code that Google suggests, because 9 times out of 10, that code is not to the highest specificity. That code is the very lowest, very non-specific option that there is. And when you pull up your code book and you look at those codes, you'll see that difference. Okay, so we have here a case study we're going to look at with our diabetes patient. And we'll find our diabetes codes in the diabetic block of our endocrine system, which starts at the beginning of E08. Just to take a brief moment through here, E08 for diabetes mellitus due to an underlying condition, meaning that there's something else that would be coded first if the patient had another disease that caused the diabetes. E09 is for drug-induced diabetes, and you will have an additional code coded first for the drug itself, so you want to remember those T codes because they would apply here. E10 is for your type 1 diabetes, and E11 is for your type 2 diabetes. Okay, E12 is not listed. There is no E12. E13 is for other specified diabetes. And you would use that in the case that none of the others apply, and so long as it's not gestational, because that's going to code to your pregnant patients, not to our diabetic section. Okay, so you coded case study on page 209 of our textbook. I'm going to read it aloud, and then we're going to code it together. We have here Tori Anderson, a 19-year-old female who was diagnosed with type 1 diabetes 2 years ago. Starting college, Tori kept forgetting to take her insulin as prescribed. She comes to the University Health Center because she feels dizzy, weak, and confused. Dr. Griffith, the on-call physician, finds her to have poor skin turgor and dry mucous membranes. He's diagnosed her with dehydration caused by insulin deficiency and diabetes mellitus type 1 uncontrolled. Okay, so we pick up a couple of things here. In all actuality, the primary diagnosis is going to be in the order that the provider gave, because the dehydration is being caused by. We do want to look and see if there's a separate code for dehydration caused by diabetes. Okay, so we're going to list dehydration. We have diabetes mellitus type 1, uncontrolled. Okay. We have, let's see, what else did we have? Dehydration uncontrolled. We also had the insulin, long-term drug use of insulin. They didn't pick that up, but I'm going to tell you we have the insulin. We should pick that up, even though it's not picked up by our book. And then we have the underdosing of insulin. And they've even picked up another Z code for us, which is, we'll find out here in a minute. So let's get started by first looking at what is the reason, what is the action out of all of these that the patient is being seen for. We would list dehydration caused by diabetes, and we would want to look at that in our alphabetical. Okay, I'm in my D's. I'm going to find it on page 122, it looks like. Dehydration E86.0. Okay, and so I'm going to go there first, E86.0. Where do we start first? We're going to start at the category code for E86. Now, I know that this is going to be within the endocrine system, and I've already looked at that chapter, so I don't need to go back to look at the chapter notes, but remember, there is a note 1 in here about neoplasms and an excludes note about pediatric conditions. This patient is 19, so neither of those would apply. E86, I want to find out which block that's under, so I will go to my chapter page, and I find that it's under metabolic disorders, E70 through E88. And so to start, I want to first look at E70 to make sure that the chapter block does not have any specific notes. When I get there on page 531, I will notice there is an excludes 1 note, which includes androgen insensitivities, congenital adrenal hyperplasia, Ehlers-Danlos syndrome, hemolytic anemias, Marfan syndrome, and 5-alpha reductase deficiencies. Wow, that one's hard to say. None of those apply to my patients, so I'm going to keep going, and I'm going to go to E86 because that was the category I was referenced to. And when I get here, I see volume depletion. Use additional code for associated disorders of electrolyte and acid-base balance from E87. Well, I didn't see any of those, so I'm not going to list that. She's not dehydrated because she wasn't drinking. She's dehydrated because of her medication was lacking. There are some excludes for newborns, hypovolemic shock, which she was not diagnosed with, post-procedural, and traumatic shocks, which, again, she was not diagnosed with. So at this point, I can go to E86.0, which is very, very specific, dehydration. So yes, that would be the most accurate code. But I also want to check all of the options that I had to make sure of that. So that is the highest specificity. Now I have diabetes mellitus type 1 uncontrolled. Now, here's the thing about diabetes mellitus with the terms controlled and uncontrolled. They used to document controlled and uncontrolled as part of the breakdown of diabetes. Some offices will tell you that if it's documented as uncontrolled, that means that their blood sugar is high, and you should code it with complications for hyperglycemia. If your doctor has agreed that in their documentation, when they say uncontrolled, they're referencing the blood sugar, and you have something in a policy that can define that, then okay, use that. But remember, as coders, unless it's something that's very specific, we don't pick up anything else. And so when we pull up diabetes, we're going to look at this and say, uncontrolled in what way? Did they tell us? Okay, so they told us what was going on, but they didn't tell us any manifestations. And so because there's not a manifestation and the blood sugar is not indicated, we unfortunately cannot pick up that higher code. So we are going to be going without complications when we pick up this diabetes. However, this would be a great opportunity to query a provider and say, hey, Dr. So-and-so, I noticed that you said that they had diabetes, or in this case, we had Dr. Griffith. I noticed you documented the patient with uncontrolled diabetes. Do you have a blood sugar test that shows us whether or not they were hyperglycemic, and would you be willing to add that? Because otherwise, it's not listed. And you would want to make sure to follow your query guidelines in keeping it open-ended when you ask that question by saying, I noticed this, I noticed that. Is this correct, or is it how you listed it, or is it something else? So always keep your query options open. Now, diabetes starts on page 130 of your alphabetical, and there's a lot of it. Oh my goodness. So I'm going to go through here rather quickly. You'll notice that diabetes mellitus is listed first with the generic code E11.9, but we know that it is type 1, so we're going to go to page 131, where we'll find type 1 in the middle of the page at E10.9. There's a lot of widths here, and because of all the complications this patient has, if I was coding this, I would read through all of that to make sure that there isn't anything about manifestations for dehydration or underdosing. In this case, there's not, so I'm going to go to just E10.9. And again, we're going to first go to the chapter, make sure where our block begins, make sure we've read all of our notes. We've already done that. We know our block begins on E08 for diabetes. Go to the block for E08. There's no additional notes before E08 starts, so we can keep going to E10, but it's important to always have that habit as you're going in your tabular. When I get to E10, I'm going to first look at the category and see what is included here, and it does have some includes notes. I'm going to read through all of those and see if my information pertains to that. It does. I mean, this patient was very specific, so I don't have to worry about what else it includes. But I should read through my excludes notes, make sure diabetes due to underlying conditions, other chemicals, gestational, hyperglycemia not otherwise specified as diabetes, do not use a diabetic code, neonatals, post-pancreatectomies, post-procedurals, and secondaries, and type 2s are all exclude ones. Well, that's nice. This isn't the case. So then I'm going to keep going. And again, you can read through each of the complications and see if any of these would apply. I would honestly be very hard-pressed to reach out to my provider before just giving them a generic non-complicated code of E10.9, which is what they gave us, without complications. I would be hard-pressed to reach out to my provider and say, hey, Dr. Griffith, would E10.65 be appropriate, and if so, can you document the hyperglycemia if the patient had it? Because that would be the difference between a different code and in some cases a difference between higher reimbursement that we would otherwise be losing because we didn't code to the highest specificity. All right, so E10.9, diabetes mellitus without complications. Even though it's uncontrolled, we didn't pick up any complications, so we have to do that. And I'm going to list E10.9, which is in fact what we found in the alphabetical as well. Okay, the next thing we want to look at is we have two things. We have insulin long-term, and we're going to look at that long-term drug use code, and we have the fact that it's underdosing. So we want to pick up the code for long-term drug use. Here's the thing about this, and a lot of people hate using this one. The definition of long-term or current drug use means that any time a patient is prescribed with something that is indicated as a long-term drug, even if it is their first visit, we need to pick up that code. And there's various reasons with testing that it applies in order to make sure we can do our regular test and get following reimbursement policies, as well as just reporting correct coding in general. So we want to identify that this patient is on this prescription, and it should not be associated with druggies or drug users just because we're using the word drug use. It is a prescription drug, and it is appropriate to list. And so even though our book did not pick it up, I'm going to add it, and we're going to start with long-term here as our key term. And we should pick this up every single time a patient has any insulin that's documented that they take. Even if she hasn't been taking it as prescribed, it didn't say she's not taking it. It says she keeps forgetting as prescribed. So that means that she is taking it, just not how she's supposed to. And I would definitely pick that up. We're going to find long-term on the bottom of page 239. You'll notice some of the parentheses tell us things like current, prophylactic, drug therapy, or use of. So long-term and current, meaning currently taking, currently prescribed drug therapy, not drug users. And then we're just going to scroll down here to find the specified drug that insulin would fall under. You'll find that at Z79.4. And so I'm going to go to my Z sections, and I'm going to verify all of those. We're going to do these a little quicker than we did before because this is chapters that have already been covered in previous lectures. Okay, so I'm just going to go to my Z tab. I review my Z code chapter, make sure all of my notes. Z79 falls under the block for Z77 through Z99, so I go to Z77. I find that on page 1278. There is a code also, any follow-up exams. We're not going to have a follow-up exam, so I'm not worried about that. And then I go to Z79. Z79, long-term or current drug use therapy, includes long-term current drug use for prophylactic purposes. Code also any therapeutic drug level monitoring. We did not monitor, which means a test, according to the documentation. There is an excludes note for drug abuse, drug use complicating pregnancies, use of oral anti-diabetic drugs, and oral hypoglycemic drugs. So I'm going to verify what exactly I have. When I get to .4, long-term and current use of insulin, Z79.4, I want to pick that up. Okay, so it didn't specify it was oral, it specified just insulin, so I feel confident in that code. Now the last one I want to do is the underdosing, so I'm going to go to my drugs and chemicals table, and I'm going to find insulin there, because she had all of these conditions due to lack of insulin properly. She was underdosing. And I'm going to go to my drugs and chemicals table, starting on 361. I'm going to find insulin. Find that on page 387 at the bottom of the first table. And here I have a couple of breakdowns. We don't have the breakdown of the type of insulin she was prescribed, so we stay with the first one for insulin. And I'm going to read across and read from the underdosing section, which is the last code of T38.3x6. And I want to verify that. Okay, T38, 3x6. All right, so now I'm going to my chapter on injuries and poisonings. I look at the beginning of the chapter. I see notes and exclusions about birth traumas that don't apply here. T38 is under category T36 through T50 for poisoning by adverse effect of underdosing, which is correct, that applies. So I'm going to go to T36 to see if there's any special notes for the block. I really wish this would tell me what page the blocks were on. That would be lovely. They don't. All right, T36 block starts on page 1128. There are includes notes, so it does include adverse effect when it's indicated as the cause. So if we remember from that before that if the cause of an injury is the drug, we don't have to code the cause separately from our causes conditions. It does have code first for the adverse effect, and it gives a few examples. We've already done that because we have the dehydration, and that was the adverse effect. It also has use additional codes for manifestations of poisonings, underdosing failure, and underdosing of medication regimen. So that right there tells me that I need to list an additional code for underdosing of medication regimen. And it gives me codes Z91 through 12 through 13 dash. So we have to break that down. So Z91.12 dash, meaning there's something past that. And that's what the comma reads as, Z91.13 dash. So I'm going to pick that up when I'm done with my T code. Then I look at T38 because I can go from there. Oh wait, I have excludes 1s and 2 notes. Neither of these for pregnancy, psychoactive drugs, non-dependence producing substances, reaction and poisoning of newborn, and pathological drug intoxication. None of those apply to my patient, so I can move on to T38. Notice how if you didn't read that note from the block, you would not have picked up this last code. So that could be a difference between having your claim approved or denied, and then you get a denial saying something's missing, and they won't tell you what they want. They just tell you it's denied. So keep that in mind. The block for T30, or the category code for T38, poisoning and adverse effect of underdosing hormones and their synthetic substances and antagonist not elsewhere classified. I'm not too worried about the exact terminology here because I know I picked that up from insulin directly. I do want to read the excludes notes. I note that there is a 7th character that's going to be added. So I have 1, 2, 3, 4, 5, 6 already. That means there's going to be a 7th one. T38, I have suggested .3. I'm going to glance at the difference between 1, 2, and 3, but honestly, I'm going to go straight here because it does say underdosing of insulin and oral hypoglycemic or anti-diabetic drugs. So I'm comfortable when I use the drugs and chemicals table to go to stop at the category, but then go straight to the 3s. In other areas, I want to read 1, then 2, then 3 before I say, yes, it's 3. Here I have a 5th character from T38.3. T38.3x is given, and it says there's a 6th character. And so I go to the 6th character and I look at the difference. I have .6, which is underdosing. And so I'll read through that and see it's exactly how my table defined it. So T38.3x6 is correct. However, I need a 7th character. And so I'm going to go back to my 7th character category table. And I'm going to remember that this is the first time she was seen for this condition, so this is going to be an initial visit. And it's initial even if she's been seen for diabetes before, because this is the initial visit for this particular condition. So this version of her dehydration, if she's had other issues in the past, it's not related to this visit now. Last but not least, I'm going to go look up that other code I picked up for underdosing of prescription regimen, Z91.12 versus 13. Same thing as with before. I want to look at the category and the block code. The block is the same one we looked at earlier, so I can rest assured that there was no follow-up examination on this visit, so I can go just directly to Z91. When I get there, Z91 category does have excludes contact with, exposure to, female genital mutilations, personal histories, and occupation exposure. Okay, well that's lovely. Now, one of the things I love about these codes, when they give us these exact codes, I can go directly to those, just making sure I make all my stops to check for exclude notes. So Z91.1 does not have any special excludes notes, which takes me to .2 and .3. .2 is patient's intentional underdosing of medication regimen And dot 3 is patient's unintentional underdosing a medication regimen. Now in this case, she said she kept forgetting to take her insulin. So we're going to be on dot 3. And it says here, code first, underdosing of medication with the T code. We have that. Excludes adverse effects of prescribed drugs taken as directed, which she didn't. She forgot how to take it or forgot to take it. And then we're going to look at the difference between dot 130 and 138. And so you have the difference is age-related debility versus other reason. So we're going to finalize that code with 138. And this one is not used. So we know our codes are all correct. Now we can list all of these. Honestly, this insulin one should be added. It can probably be last in your order. Your biggest important factor is having the dehydration and the diabetes first, the T code secondary to that, and the Z codes at some point after. Whew, take a deep breath. We did it. We're done. Yay. So now we've coded this one case of this patient with diabetes and dehydration. It does take a little bit of time at times when there's complications to diabetes, so make sure you take your time to read through the notes and give yourself enough time for studying when you're learning about these types of codes. The last thing I just wanted to mention briefly was about vitamin deficiencies, and we kind of talked about that already, in that you can only code deficiencies of a vitamin or a hormone when it is in fact documented in interpretation from the lab results. And if you watch the first part of this lecture where I talked about endocrine, nutritional, metabolic diseases, I also mentioned to you that we can pick up anything that is documented with the lab results, but you cannot code from the lab results if it's not interpreted by your doctor. That's all I have for today. So take care and make sure you check back in for other videos and topics in ICD-10 CM coding.